Hi everyone, welcome back to Burst TV. My name is Amy and I'm a Burst ambassador and some would say an entirely too curious dental hygienist. So when this wife reached out to our Burst TV crew with these words, "Help, my husband is snoring and I can't sleep," I really wondered what options there were to choose from. I also may be a fellow sleep deprived wife. Does this sound familiar to anyone? I can't tell you the things that we've tried. So let's see what to do. You could totally get your own room, or better yet, you could do like I did the other night and just kick them to the couch. But for those of you that actually want to cuddle with your spouse, let's break into some options that might keep your relationship and your health intact. So what is snoring? It sounds silly to ask, but most people think that it's a sound from the nose. Actually, the noise itself is produced in the back of your airway behind your tongue. It's made when your tissue vibrates while the air is trying to move around the blockages. So when you sleep, your muscles relax, your tongue falls to the back of your throat, and bam, little piggy noises. Considering that up to 50% of the population snores, I'm sure some of you watching are pretty sleep deprived. There are certain risk factors that make snoring more common, like being overweight, trouble with your sinuses, aging, and even pregnancy. So what can we do? Well, we can tell our spouse or our patients to avoid alcohol right before bed. They can try sleeping on their sides or even try to lose a bit of weight. I don't know about you guys, but I'm just going to leave that last one alone. Well, let me tell you guys, I've tried it all. Earplugs, they did work, but depending on if you need an alarm in the morning to wake you up, just don't plan on hearing that either. How about this handy dandy anti-snoring nose clip? So I used this. It didn't work, and in fact, it hurt pretty bad. Then I ordered these awesome nose filtration thingy-mabobbers. So, okay, I have been known to snore a time or two, maybe when my allergies are acting up. This toleration lasted about 10.2 seconds. These are definitely not my husband's. You can also use breathing strips to yank your nose to kingdom come. There's so many products, and you can try them all, but as dental professionals, we always want to make sure that our patients are taking care of their health first. So what can be done in the office to screen patients and help determine if this is just snoring or maybe sleep apnea? Now, sleep apnea is a much more serious condition in which the person stops breathing 5 or more times an hour. In the dental setting, we can use our communication skills, our eyes, and we can use high-tech options to help patients determine if the patient should be concerned about a little snoring. Of course, we're not able to diagnose the patient. We're merely just suggesting that they seek their medical doctor's advice here. So the first thing dental professionals can do is ask the patient about sleep habits. Are you waking at night? Are you not feeling rested in the morning? Has your spouse or significant other told you that you seem to be not breathing? Have you maybe been shoved completely off your bed? Do you wake up with a desert for a mouth? Do you have a sore throat in the morning? Do you have frequent headaches? If the patient has some yeses here, then you can move forward with x-rays and a visual exam. If the office that you work in has a cone beam available, we can also use that to determine if there's a small airway. From there, we can visually examine and check for signs of bruxing. Bruxing is related to sleep apnea because when you tense your jaw or you grind your teeth, it actually sends a signal to our brain that you need to breathe. Our bodies are pretty amazing. We can also look for a scalloped tongue, a red throat, class 2 occlusion, a narrow, vaulted hard palate, and then we can lean the patient back and just note if we can see any tissue towards the back of the throat, like uvula, tonsils, those kind of things. And lastly, do we see a deviated septum? Based off of our findings there, we can recommend the patient get a sleep study. Once this is done, we can present the patient with options for treatment or recommend that they see their physician. Most patients, after the sleep study has been diagnosed, will have been presented with a CPAP as option 1. Depending on whether their apnea is obstructive, they may have been given a full face mask, such as this one, like my husband's. So I'll show you here. I mean, who wouldn't want to wear this? Like, I look amazing. I feel completely relaxed, you know? Or if they're lucky, they may get to wear the cute little nostril mask as seen here by Philip Respironics. And even cute little kiddos are now getting diagnosed earlier and earlier as we learn more about sleep apnea. This little girl is the only one that's going to look adorable wearing this thing. This one's made by ResMed. So if your patient is like my husband and they won't tolerate the mask, they may choose to wear a dental appliance instead. I've worked with some dentists that recommend their patient try an over-the-counter snore guard before they invest in a one from the lab. This one here is made by IntelliGuard Pro. It's around $20. Or this one here, this made by Z-Quiet, which runs around $70. A lot of dental insurance will not cover a lab-made product or appliance. So as a patient, you may want to ask your dentist if they file with medical insurance first. The professionally made appliances can cost between $2,500 to $4,000 with no insurance, but they will fit your mouth perfectly, which means a much higher rate of compliance. This one here is made by ProSomnus. You can see how it covers the biting surfaces, but not too much. It just helps with patient comfort. So, and these are SomnoMed devices, two of the more popular, the Avent and then the Advance Elite. When your patient hears the costs associated, you might get some backpedaling. So how do we make this important to our patient? We can tell them untreated sleep apnea can lead to dental caries. We already know that it's related to bruxing. I mean, short teeth are cute, I guess, but they could also crack and break. A mouthful of crown work is just much more expensive than an appliance. Not to mention the health risks associated here. Type 2 diabetes, high blood pressure, the risk of heart disease, heart failure, stroke, GERD. GERD leads to erosion on our enamel, nocturnal angina, anyone? I mean, I just love some heart pain, and hypothyroidism. Whew. I mean, if that doesn't work, you can just tell them when you schedule your 6-month appointment that you hope to see them if they make it. As for your spouse, you can make them watch this video, then turn sideways on the bed and give them a great donkey kick, just like right to the ground. Given these choices, which one would you guys pick? I definitely think I would go for something like this, like the well-made guard. Leave you guys' choices in the comments, and then don't forget to hit that subscribe button while you're there. And I hope you all get some sleep.